All right, so now we're going over the heart model, and excuse the eye black, but we just finished the PT Olympics. So looking at the heart, we can see the right atria, the right auricle, and the right ventricle, and the left atria, left auricle, and left ventricle. We can see the coronary sulcus, which is this yellow right here, and it wraps around back. And we can see the interventricular sulcus right here, which is this yellow. Off of the ascending aorta, right after it passes through the valve, we have two branches, which is the right and the left coronary arteries. So we can see the right coronary artery right here, but we can't see the left coronary artery, but we can see the branches that comes off. This is the circumflex artery, and this is the anterior descending artery right here. The anterior descending artery. Off of the right coronary artery, we have the marginal artery right here, and the posterior descending artery right here. We also have some veins, like the great cardiac vein, which is right here. We have the small cardiac vein, which is right here. And we have the middle cardiac vein, which is right here. All of these veins drain into the coronary sinus, which is right here, and that coronary sinus drains into the right atrium. Okay, now we can see that this is the apex of the heart, and we can see the base of the heart right here. Now on the base of the heart, we can see the superior vena cava and the inferior vena cava. And we can also see that going into the superior vena cava, we can see the right and left brachiocephalic veins. We can also see that the blood will go through here and into the pulmonary trunk, right here, into the pulmonary arteries. So those arteries are going to go into the lungs and come back into the pulmonary veins, which drain into the left side of the heart, and that goes into the ascending aorta, the aortic arch, and the descending aorta. On the aortic arch, there's three branches, which is the brachiocephalic trunk, and that splits into the right common carotid and the right subclavian artery. We have the left common carotid and the left subclavian arteries as well. This is ligamentum arteriosum right here, and I don't think there's anything else on the outside of the heart. So now let's look on the inside of the heart. So looking at the inside of the heart here, we can start to see some of the valves. So these are the AV valves, the atrioventricular valves. We have the tricuspid valve and the bicuspid valve. The tricuspid valve separates the right atria and ventricle. Bicuspid separates the left atria and left ventricle. On this valve right here, we can see the chordae tendineae, which attach to the papillary muscles right here. And if we look behind this valve, we can see the trabeculae carneae, and we can see the pectinate muscles in the atrium. You can't really see it on that part, but on this part of it, you can see those pectinate muscles. If we also look inside the right atrium, we can see fossa ovalis right here, and then we can also see the opening to the cardiac sinus, the coronary sinus right here. We have the interventricular septum right here, and we can see the three layers of the heart muscle, which is the epicardium, the myocardium, and the endocardium, which is the inside. So we talked about those two valves, but there's also two other valves. We have the semilunar valves, which this one is broken, but we can see this one. So this, what would be here, would be the pulmonary semilunar valve. That separates the right ventricle and the pulmonary system. And then we can see the aortic semilunar valve, which separates the left ventricle and the systemic circulation. And I think that's everything for the structures of the heart. All right, now we're going over the bronchial tree model. So I don't know where the right side went, but we're gonna pretend like it's there. So we have the trachea right here. The trachea splits into the left and the right lungs at the carina. Splitting off the carina, we have the left and right primary bronchi. And this left primary bronchi splits into the secondary bronchi, or the lobar bronchi. This is the superior lobar bronchi and the inferior lobar bronchi. And then we can see the tertiary bronchi right here. And then off of the right side, we have the right primary bronchi. And there's supposed to be 3 secondary or lobar bronchi, but we're going to pretend like it's there. So we have the superior lobar bronchi, where there's supposed to be a middle lobar bronchi and an inferior lobar bronchi on this right side. And we can also see the tertiary bronchi right here. So this is where like the blood would go after the pulmonary trunk into the pulmonary arteries that we looked at in the heart. It would go into the lungs and it would come back to the heart in the pulmonary veins. And now let's talk about some of the circulation. All right, lastly, let's go over the pathway of the blood through the heart. So we're gonna pretend like we're a little red blood cell. And we're gonna enter here through the superior vena cava into the right atrium. And in the right atrium, we're gonna pass through this tricuspid valve into the right ventricle. And the right ventricle is gonna pump us through the pulmonary semilunar valve into this pulmonary trunk and into the pulmonary arteries. So these pulmonary arteries are gonna carry us into the lungs to be full of oxygen. So like it's blue right now, no oxygen. It's gonna fill us with oxygen. And then we're going to come back to the heart through the pulmonary veins right here. So now they're red, we're oxygenated. Pulmonary veins are gonna drain into the left atrium, and the left atrium is gonna pump the blood through the bicuspid valve into the left ventricle. And this is, the left ventricle right here is going to pump the blood into the systemic circulation. It's gonna pump it through the aortic semilunar valve, right here, aortic semilunar valve. And through the aortic semilunar valve, we're going to go into the ascending aorta. And remember, branching off of the ascending aorta is the right and left coronary arteries. We're gonna go up through the ascending aorta, aortic arch. Remember there's those 3 branches right here, and into the descending aorta. And then that's gonna carry us through the systemic circulation so we can oxygenate all the tissues in the body. And that is the heart model.